Have you ever stopped to think about how fast healthcare is changing? Not just, new drugs or surgeries, but the data behind it all. Today, that's exactly what we're diving into, the global health analytics market. We're going to pull out the really key insights, maybe some surprising facts, too, from the latest research, give you a shortcut to understanding this exploding field. Think of it like a map for where health tech is going.
That's a great way to put it. Yeah, our deep dive today, it's grounded in a really detailed forecast from Cognitive Market Research. The report's called Global Health Analytics Market Forecast 2021-2033. And looking at these projections, well, it's crucial for anyone tracking healthcare or tech's future.
Right. So our mission today is pretty clear. Boil down this dense forecast into what you really need to know. By the end of this, you should feel pretty well informed about where health analytics is headed globally. Okay, let's get into it. Let's start with the big picture. Because the growth path for this market globally is, well, it's really something. Okay, so back in 2021, the whole market was valued at just under $30 billion, $29.391 billion to be exact. Now jump ahead just to 2025. It's expected to hit over $62 billion. So more than double. But here's a really eye-opening part. By 2033, the projection is $281.948 billion. That works out to a compound annual growth rate, CAGR, of over 20% every year for more than a decade. That's impressive.
Yeah, it is. And what's fascinating here, it's not just the final number, huge as it is, it's the speed, the velocity, seeing sustained growth over 20% annually. That's quite rare, really, in almost any sector. It signals a massive shift. We're moving past healthcare just reacting to problems. This level of investment, it shows healthcare is fundamentally rebuilding itself, becoming data-driven, using analytics to, predict needs, tailor treatments, streamline everything. It's a total reimagining of care delivery.
That velocity, yeah, that's definitely what jumps out. So where's this growth happening fastest? Maybe not surprisingly, North America seems to be leading the charge here. In 2021, the market there was already about $15 billion. That's set to climb past $31 billion by 2025. And the 2033 projection, almost $139 billion. Now, if we break down North America a bit, the United States is, well, it's the dominant force by far. It had over $12.5 billion back in 2021. The forecast for 2033, over $114 billion, just staggering. But, it's not only the U.S. Canada is showing really strong growth, too. It started around $1.5 billion, roughly, in 2021, projected to reach nearly $16 billion by 2033. And Mexico's right in there, too, showing strong momentum. It goes from under $1 billion in 2021 to over $8 billion predicted by 2033.
And if we connect this to the bigger picture, North America's lead makes sense. It isn't just about market size. You've got a mature healthcare system, relatively speaking, plus really high-tech adoption rates, and importantly, a lot of venture capital flowing into health tech specifically. So they have the frameworks, the infrastructure, and the money, frankly, to integrate these advanced data solutions quickly. They're pushing the envelope.
Okay, that makes sense. Now let's hop across the Atlantic. Europe, also making really significant contributions, right? Showing strong growth. The whole region was just over $5 billion back in 2021, and it's expected to grow to nearly $46 billion by 2033. So substantial. And while North America's numbers are maybe more dramatic, Europe's participation is broad. You see it everywhere. Germany, for instance, over $1 billion in 2021, projected to grow to over $10 billion by 2033. The UK is also strong. Around $844 million starting out, heading towards nearly $7.8 billion. Then you've got France, Italy, Spain, all showing consistent, strong growth paths. And it's not just the big economies. Even places like Luxembourg are seeing big proportional increases, from $77 million to over $627 million.
Right. And what's interesting about Europe, I think, is the diversity. You have all of these different healthcare models, right? Single payer, more private systems, various regulations. But despite that variation, there's this shared commitment you see across the board to using data better. This widespread adoption, it really underlines the universal value people see in health analytics. Every country sees the benefits, regardless of their specific system.
That's a great point. Okay, now let's talk Asia Pacific, because this region is often described as, well, booming, and the numbers back that up. The total for APAC is forecast to jump from just under $5 billion in 2021 down to an incredible $55 billion plus by 2033. Within Asia Pacific, China's obviously a huge player. It's projected to grow from about $1.6 billion to over $18.7 billion. Massive scale. But here's something really striking: India's rapid rise. It started at $661 million in 2021, the forecast, over $8 billion by 2033. That's just just phenomenal growth. And we're seeing sharp growth curves in Japan, South Korea, Australia too, plus strong momentum in Southeast Asia. Singapore, for instance, is projected to hit over $2.7 billion by 2033. Southeast Asia as a block, over $4 billion. This is where it gets really interesting, I think. Just the sheer speed of growth across Asia Pacific. It's astounding.
It really is. And this rapid expansion there, it brings up a key question, doesn't it? How will health analytics specifically change healthcare access and efficiency in that region? You've got enormous populations, huge diversity in economic development, the potential for data to help these countries maybe leapfrog some traditional healthcare hurdles, scale digital health quickly, optimize scarcer resources. It's immense. It could really change things for billions of people.
That leapfrogging potential is fascinating. Okay, let's round out the globe. South America, seeing robust growth outlined there too. From about $1.6 billion in 2021 to over $16 billion projected by 2033. Brazil leads the region, expected to jump from $650 million to over $6 billion. And other key countries like Argentina, Colombia, Peru, Chile, they're all showing solid upward trends, each looking to pass the $1 billion mark by 2033. Okay, next up, the Middle East, set to climb from nearly $1.5 billion in 2021 to over $14.7 billion by 2033. Saudi Arabia, the UAE, Turkey, they're particularly strong contributors there, reflect some pretty ambitious healthcare modernization plans in the region. And finally, Africa. Its market started around $1.1 billion in 2021, expected to nearly double to $2.5 billion by 2025, and then reach a very substantial $11.1 billion by 2033. South Africa is leading the continent there, projected growth from $456 million to nearly $4.7 billion. Nigeria is also seeing impressive gains, and the rest of Africa category is significant too.
So if you step back and look at this whole global picture, what does it all mean? It means this shift towards data-driven healthcare isn't just happening in a few hotspots. It's truly a global phenomenon. Every continent, pretty much every major region, is making significant investments. It shows this universal understanding that data insights aren't just nice to have anymore. They're essential. Essential for building healthcare systems that are more effective, more efficient, and more personalized. It's a fundamental retooling for the 21st century, really.
It really is quite something, seeing that consistent, massive adoption everywhere. So just to hammer it home, we're looking at a global health analytics market projected to hit $281.948 billion by 2033. This isn't just slow and steady growth. It's a genuine technological transformation reshaping healthcare.
Exactly. And maybe that leads to a final thought, a question for you, our listener. As health analytics keeps growing so fast, enabling care that's more predictive, more precise, more personal, what new possibilities do you see? And maybe just as importantly, what new challenges might emerge? Thinking about things like patient care, but also privacy, equity, access. What does this look like in the next decade from your perspective?
That's a great question to ponder. We really hope this deep dive gave you a clearer view of this explosive growth and what it means. Thanks so much for joining us today on the Deep Dive. We definitely encourage you to keep an eye on these crucial developments in health technology. Welcome to the Deep Dive, your shortcut to being genuinely well-informed. Today, we're diving into a really fascinating area, one that's, well, quietly reshaping one of the most personal parts of all our lives, healthcare. We're talking about the health analytics market. It's basically where data science meets medicine, our mission.
To unpack what you really need to know about this critical, fast-growing space.
Yeah, and it's so important we do this deep dive because getting a handle on health analytics isn't just, tech watching. It's really about understanding where medicine itself is heading, how data is giving more power to both patients and doctors, making healthcare smarter, more tailored, and hopefully more effective for you.
Okay, so let's unpack that. How did we get here? I mean, this idea of healthcare being predictive, personalized. Where does that even start?
Well, the foundation, the first really big piece, seems to be the huge shift towards electronic health records, EHRs, and all sorts of digital health tools.
Exactly. That move away from paper files, that's the absolute bedrock. It's not just about convenience, it's about creating structured data.
Structured data.
Meaning the information is organized, right? In clear fields, almost like a massive spreadsheet for each patient, but much more complex, obviously. So it's searchable, queryable. Algorithms can suddenly spot patterns across thousands, even millions of records, things a human eye just couldn't see before, or would take ages to find.
Right, so you can actually analyze it systematically.
Precisely. And that digital structure is what makes real-time insights and predictive modeling even possible. Like a whole new ballgame compared to shuffling through paper charts.
Okay, that makes sense. So that digital leap, how does that connect to the next big thing? You mentioned personalized care.
Well, it fuels it directly. That's the second major driver.
Right.
This huge demand now for personalized and predictive healthcare. And it's not just a nice to have. The whole industry is shifting towards something called value-based care.
Value-based care, meaning paying for results, not just procedures.
Exactly. Doctors and hospitals are increasingly rewarded for patient outcomes, not just how many tests they run. And analytics is the engine for that. It's how you prove what works, how you link the money to actual health improvements. It creates real accountability.
Interesting. So data helps prove value.
Yes, using this incredibly rich mix of data, genetic, behavioral, clinical stuff. And now, with AI platforms getting so powerful, we can actually start to predict diseases before they show up, and then recommend interventions that are truly tailored to that specific person, aiming for better long-term health.
Wow, okay. So EHRs enable the data, which fuels personalized, value-based care. It's the third leg of this stool. Has to be costs, right? Healthcare costs are always climbing.
Absolutely. That's the third crucial driver, the constant pressure of rising healthcare costs. And analytics offers a powerful way to tackle this. But it's not just about blunt cuts. Well, it's smarter than that. Analytics can pinpoint waste. It can show which expensive treatments maybe aren't that effective for certain patients. So you can redirect those resources, perhaps towards preventative care that actually saves money and improves health down the line.
I see. Cutting waste, not just services.
Exactly. It helps reduce unnecessary tests. It helps hospitals figure out optimal staffing. It can even detect fraud, which is a surprisingly big drain. And it streamlines things like insurance claims. So for hospitals, insurers, government agencies, it drives efficiency.
So what this really means is a fundamental shift,
Mhm.
moving away from just paying for doing stuff to paying for results and efficiency.
That's the goal, a value-based system, ultimately trimming costs and improving care quality across the board.
Okay, that all sounds incredibly promising, but
Yeah.
there have to be downsides, right? Challenges. What are the main hurdles slowing this down?
Oh, definitely. The research calls them restraints. And the biggest one, unsurprisingly, is data privacy and security.
Right. We're talking about incredibly sensitive information here, your health records.
Exactly. Managing these enormous volumes of personal health data is, well, it's a massive challenge. You've got huge cybersecurity risks. A breach isn't just a technical problem. It can have devastating legal consequences.
Destroy public trust.
Implant-
Completely.
Absolutely. People need to trust that their most private information is safe. And then you have regulations like HIPAA in the US, GDPR over in Europe. They're vital, of course.
But complex.
Very complex. They create these intricate compliance requirements that honestly can sometimes slow down innovation or make it harder to share data between hospitals, even when it could really benefit patients. It's a tough balance.
Yeah, I can see that. Okay, privacy is huge. What else?
Well, this raises the human factor. There's a real shortage of people with the right skills.
You mean data scientists?
Data scientists, yes, but more specifically, people who understand data science and bioinformatics and how hospitals actually work, the clinical side. It's a unique mix. You need people who can bridge that gap between the medical world and the machine learning world.
And those people are hard to find.
Especially in some regions, yeah. Many organizations, particularly maybe in emerging markets, just don't have access to that kind of specialized talent. And that talent gap really puts the brakes on fully integrating analytics, no matter how much data you've collected.
Okay, so privacy hurdles, skills gaps. What about the tech itself? Is the data easy to use once you have it? I'm guessing. Probably not.
You guessed right. That leads to another major headache, data fragmentation and interoperability. Or lack thereof.
Or fragmentation, meaning it's all over the place.
Pretty much. Health data often lives in completely separate, incompatible systems. Think about it. Your hospital's EHR, your insurance company's claims data, results from different labs, maybe data from your fitness tracker.
But they don't talk to each other.
Exactly. It's like trying to assemble a puzzle where the pieces are from different boxes and don't fit together. Without common standards or ways for these systems to connect seamlessly, getting a single, unified view of a patient or a population is incredibly difficult.
So you can have all the data in the world, but if it's stuck in silos, its usefulness is limited.
Precisely. It really limits the power and accuracy of the analytics you can run across the whole healthcare journey.
Okay, so challenges are definitely there. Privacy, skills, fragmentation. But let's shift gears. Despite these hurdles, what are the exciting trends pushing this forward? Where does it get really interesting?
Well, this is where the potential really shines. A huge trend is the deeper and deeper integration of AI, artificial intelligence, and machine learning right into clinical decision-making.
How does that actually work? Like, what does it look like for a doctor?
Think about the sheer flood of data a doctor faces: scans, lab results, patient history, vital signs, medical literature. It's overwhelming. AI tools are now helping them process that information much faster. They can detect subtle patterns in, say, medical images or patient data that a human might miss.
So like a superpowered assistant.
In a way, yes, helping them make faster, more accurate diagnoses or treatment decisions. It's especially powerful in things like spotting diseases earlier than ever before, or in what's called risk stratification.
Risk stratification.
Yeah, basically identifying which patients are at the highest risk of developing a certain condition or having a bad outcome. Imagine being able to flag someone highly likely to have a heart attack before they have any symptoms, allowing for preventative steps. That's a game changer.
Wow. Okay, AI is clearly a big one. What else is on the horizon?
Well, connecting to that is the massive growth in real-time and predictive analytics.
Driven by things like wearables, my smartwatch, fitness trackers.
Exactly. Plus, remote monitoring devices used in hospitals or even at home, all those Internet of Things medical gadgets. This allows for continuous monitoring. Hospitals can track patients in real time, spot worrying signs, anomalies much earlier.
Preventing emergencies before they happen.
That's the idea, maybe preventing things like a sudden cardiac arrest or a dangerous dip in blood sugar for a diabetic patient. And beyond emergencies, it's transforming how we manage chronic diseases. Predictive models can forecast potential complications, letting doctors intervene proactively.
So moving from just treating illness when it happens to actively managing health continuously.
Precisely. It's a much more proactive approach.
Okay, AI, real-time data.
Yeah.
What's enabling all this heavy-duty analysis? Where does all this data live and get processed?
That brings us to the third big trend, the rapid expansion of cloud-based analytics solutions.
Moving analytics to the cloud. Why is that significant?
Several reasons. Cloud platforms offer, well, first, cost effectiveness. You don't need massive on-site server farms. They're also incredibly scalable. You can easily handle growing volumes of data. And they offer very robust security, which is crucial, as we discussed.
Right, security is paramount.
And importantly, the cloud makes collaboration easier. It enables sharing data securely across different hospitals or research institutions, even across borders. This supports multi-institutional studies, accelerates research, and lets doctors share insights more easily. It's really becoming the standard approach.
So the cloud provides the scalable, secure backbone for all this advanced analysis.
You got it. It ties a lot of these trends together. So if we were to sum all this up, it's clear the health analytics market is set for, well, pretty substantial growth. You've got the push from digital health adoption, this demand for personalized care we talked about, and the constant drive for efficiency. Those are powerful forces.
Yeah, the momentum seems undeniable.
But as we covered, it's not without its challenges. It absolutely has to navigate those complex regulations, address the talent shortage, and really work on solving that data fragmentation problem.
Right, those hurdles are significant. But still, looking ahead, with AI, real-time monitoring, cloud computing really accelerating, the future does look incredibly bright, doesn't it?
It really does. It's fundamentally changing healthcare.
Moving us closer to that goal of a system that's genuinely proactive, personalized, and hopefully more effective for everyone. So here's something for you, our listener, to think about. As health analytics gets more powerful, how might it impact your own health decisions, your privacy, and maybe what role or responsibility might you have in managing your own digital health footprint in this changing world? Lots to consider. Thank you for joining us on this deep dive into the health analytics market.